growth in the number of cases in the Latino community is alarming.
El crecimiento en el número de casos en la comunidad latina es alarmante.
Last week, Utah's Governor Gary Herbert held a press conference with Spanish translators and speakers to address the disproportionate number of COVID-19 cases in our Latino and Hispanic communities. Tonight, we are discussing a positive path forward through this crisis with our panel, State Senator Luz Escamilla and then State Representative Angela Romero. Now, that press conference reiterated CDC guidelines and listed resources available in Spanish to our Hispanic communities. So let's now talk, ladies, about the other efforts that our state is spearheading to stop the spread in these communities. Let's start with you, Representative Romero.
Well, as I mentioned earlier, Senator Escamilla and I worked with the state of Utah to start the community COVID community partnership. But another piece of this was the multicultural task force, and what their funding was, what they secured funding for is to do more education in multiple languages and to educate our local businesses. And so for us, it's about who are the individuals that people trust, who can they go to give them the right information. And that's just a small component of it, but I would turn the time over to Senator Escamilla really to talk about the COVID community partnership, because that's the key to what we're trying to do, is to really ensure that people are getting tested and that they have access to the services that they need.
Senator, let's talk about that.
Yes, thank you, Emily. And to us, has been a focus on testing. So how do we make sure that there's access to adequate testing? But then what do you do after you get tested and you become positive? You have to isolate, and we use quarantine and isolation sometimes interchangeably. There are different definitions and different things. But if you think about a working family that needs, money to pay the rent or food security, then if you don't have those, it's really difficult. So what we've done is we created a program with community health workers. It's basically cultural brokers that are helping us get to those communities. There's already a relationship between those communities and the community health workers. Those community-based organizations deploy them, and what they're doing is they're educating, not only educating about testing and COVID-19 in general, but if you're positive, you have to go now through contact tracing. And I don't know if anyone has gone through that, but that's a pretty invasive process. And if communities have trust issues with government, can you imagine now you're having to disclose every information, phone numbers, addresses, people, everything. So having these cultural brokers have been best practice, evidence-based approaches. Is very data-driven. We're going where hotspots are, and it's been an effort of love and a lot of work between the executive branch, as Representative Romero mentioned, with the state of Utah, the Department of Health, Office of Health Disparities, and also the county and Salt Lake City, because that's where some of those biggest hotspots are. We know they're in other parts of the state as well, so we now have grown to a point where we have more than 100 now community health workers that will be deployed across the state to make sure these communities get interventions that are data-driven and evidence-based.
And also that love. I love that you included that in the middle of all that. Now, the legislature held a special session in April and another just a couple weeks ago. You guys have been so busy, where you addressed aspects of this pandemic. So let's talk about what you and other lawmakers discussed to help these communities hit especially hard by the virus, and what action came of that discussion. Representative, let's go with you first.
Again, as the senator mentioned, we were able to secure $2.5 million in CARES Act funding that specifically went to diverse communities and ensuring that we were able to outreach to these diverse communities. The other thing is we extended our state of emergency so that if we needed to, we could receive more federal funding, and that's huge, especially when you look at the rates of COVID-19. They're not going down, they're going up. And so as we move further, we need to ensure that we're protecting the citizens of Utah and providing them with the services they need, and we need funding to do that.
Okay. Now, unfortunately, we need to wrap for now. We will, of course, continue this conversation in just a couple of moments.